It's a Northwest lifestyle weekend on KOMO News. This is IRG's Health Talk. Back to Tom Hutler and Shannon O'Kelly.
First guest today is Dr. Tom Miller, Overlake Hospital Medical Director on Quality and Safety and a longtime emergency department physician. We're talking about something you just don't hear about that much these days, Shannon. That's rabies. But it's still there. It's still a thing, and you got to be aware of it.
Yeah, it's out there. I mean, recently I've in newspapers, there's been several bats that have been found that have had tested positive for rabies, and so it's something that's still out there in these parks and sheds and your house, and so it's interesting to find out about it.
Yeah, anxious to hear what Dr. Miller has to say. Here's Tom Miller and Shannon O'Kelly.
Dr. Tom Miller, welcome to Health Talk. Thanks for coming. How are you?
I am well. Thanks for having me.
Well, I'm excited you're here. I'm personally really excited you're here because we're going to talk about rabies, but I need to tell you a story. And for our listeners, you're an ER physician and you work at Overlake Hospital.
Correct.
And, so you see a lot of different things in the ER, but I got to tell you a story here. So this summer, I'm up at my cabin, and it's a nice night, beautiful night. We have the doors open to the cabin, letting the airflow, the summer airflow. I go to sleep that night. And I wake up at 3 o'clock in the morning because I hear this foof, 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 foof in my room. And I look up and I go, that's a bat. That's a bat in my bedroom. So I jump out of bed real quick, run downstairs, close the door to the bedroom, run downstairs, and I Google bat in the house. And now I'm freaked out. Okay, totally freaked out because they're saying if you have a bat and you're asleep, you need to get that bat and you need to get it tested because apparently a bat can bite you and you might not even know it if you're a deep sleeper.
That's
correct. So now I'm like going, oh my gosh, what am I going to do? And then I read, you're not supposed to kill them, let them outside and all this stuff. So I'm confused, right? So I went up and unfortunately had to end up getting the bat. I caught it and I had to get it tested and luckily it was negative. And so I feel really comfortable about that. But I was really worried because like the next week or so, 3 incidents in the paper in Seattle, one at Green Lake, one down south and somewhere else, they're finding bats with rabies. And I'm thinking, I've never heard of this. And how common is it? And you're an ER doc, so tell us about it.
Okay, well, actually bats are the most common vector source of rabies exposure in the state. And it is not an uncommon sort of situation. There are usually around 300 exposures of people, encounters they're called, across the state annually. And bats comprise about 80% of those exposures.
Exposure to rabies or potential rabies.
Correct.
And tell our listeners, I mean, when I did the research and I started looking into it, and I took my bat to the Skagit County Health Department, and they tested it for me for free,
yes,
which was really nice of them, and it took like 24 hours, and they got it back. But, if generally speaking, if a bat is flying around, what I understand now, and moving, they're healthy. It's the bats that are not moving that pretend are sick. Is that what you know?
Well, if the bat is flying, first of all, it may be healthy, probably is healthy, and you want to be rather careful trying to catch a flying bat.
Yeah, tell me about it. You got to see me at 3 o'clock in the morning trying to get this bat. It was good video. I should have taken it. It would have been a YouTube sensation.
Well, the most common scenario is if the bat is actually rabid, that it will be behaving in an unusual fashion. Often they won't be able to fly. They'll be flopping around, often on the ground, often during the day, which is unusual. And that's the situation where you're probably most likely to encounter a bat that actually is rabid or is infected with rabies.
And if that bat is sick, I mean, do people, when you experience people that are bit by a bat that you suspect might have rabies because that bat potentially is not moving, is it because they're trying to catch it, or what are they doing? How do they get bit? Why would anybody pick a bat up that's looks like it might be sick or just sit in your house?
Yes, most commonly in my experience, it hasn't been that they are trying to catch the bat and they get bitten, but rather they're in the same room and they were either asleep and don't recall what happened, or the bat actually, if it happens to be in their vicinity, may have contacted them, and whether a bite or not. And that's the most common sort of scenario. I haven't seen that many patients who have tried to catch a bat and got bitten, but I will once again say you want to be very cautious. If you do have a bat that's impaired, it is recommended that you can find that bat somehow, but you have to do it very carefully and not risk yourself being exposed.
We are talking about rabies with Dr. Tom Miller at Overlake Hospital, Medical Director of Quality and Safety, and we'll continue the conversation next on KOMO.
It's a Northwest Lifestyle Weekend on KOMO News. IRG's Health Talk continues.
Our conversation with Dr. Tom Miller on the subject of rabies continues now on IRG Physical and Hand Therapy's Health Talk.
So, Dr. Miller, we're talking rabies and we're talking about bats. And as I mentioned earlier on, it seems like there's been a lot of bat stories, rabid bats in the Puget Sound. As an ER doc at Overlake Hospital through this summer, did you see increased exposure to rabies?
Well, we often see at least one case in the emergency department where there's a question of whether there's been an exposure or not, and it's typically a bat. Often the bat hasn't been caught, so then we have to decide whether the patient is at risk or not, and whether to give the both the immune globulin if they've been bitten, or if not, the rabies immunization series.
Yeah, as we talk about kind of the treatment for rabies, hey, folks out there, listen, rabies is fatal. I mean, if you have the symptoms, you don't recover, right?
The fatality rate is over 90% for rabies if you contract
scary.
it. Yes,
that's
it is.
That's scary. I mean, is rabies a bacteria or is it a virus?
It's a virus. It's actually a number of different species of viruses, but they all belong to the same general category. So it's viral transmission.
And you kind of feel like, I think the symptoms kind of feel like you have the flu. It starts out like a flu-ish type symptoms?
Usually, yes. Muscle aches, headache, fever, generally feeling like you've got a flu-like syndrome.
So I have to ask this question. In the state of Washington, by law, you're required to vaccinate your dogs and cats for rabies.
Correct.
Why don't we just automatically give humans a shot for it? Because it's fatal. I mean, why do you have to take this chance? Did I get bit? Do I need to get tested? And the reality is, if you think you've been bitten, you need to get the vaccination early. I mean, within, 14 days or 7 days?
The sooner the better.
Right,
but
yeah.
Yes, the symptoms typically show up within 2 to 8 weeks, and by that time, you're kind of behind the curve. So you want to get it as soon as possible, within 2 weeks, certainly. And the reason that probably we don't immunize everyone, first of all, it's a series of immunizations. It is costly, and the risk is actually quite low. If someone is going to an endemic area in Africa, Mexico, South America, where there is a higher risk of exposure to bats, to dogs, to other wild animals that carry rabies, and there's a high incidence of carriage down there or over there, then we would immunize. For veterinary students, they get immunized. But if you're in the general population, the risk is so low, the cost and the discomfort relatively high, it's not worth it as a public health measure.
You're not really vaccinating people unless there's potential exposure. And again, if you're sleeping in a room and you find a bat and you can get the bat tested, that's the best way to handle that?
Correct. They can test very quickly, as you know, within 24 or 48 hours usually. If you are able to capture the bat, do it very safely, wear gloves, make sure that you take precautions. You can go online and find out how to catch a bat.
I did. Well, Dr. Miller, thank you for your time. From a personal experience, I appreciate your information.
Happy to do it. Thanks for having me.
We've been talking about rabies with Dr. Tom Miller, and you can get more information at overlakehospital.org. Rabies, Shannon, I'm not sure what the situation is about. I just used to hear when we were younger about all these dreadful shots you had to get if they suspected you had rabies.
Yeah, it's changed. I mean, there's 4 or 5 shots. I mean, like I was telling you and talking to Dr. Miller, I had an experience with a bat in my house this summer, scared the daylights out of me, waking up with something flying around your house. So I was really concerned about it because they can bite you in your sleep and you can't even tell you got bit.
It is scary.
Yeah,
especially at this time of the year. All right, our next guest coming up right after this time out on KOMO.